We're at a moment in history where medical care is being debated, and I see it as who deserves it. And the way I think of medical care, everyone deserves culturally competent medical care. They deserve care that affirms who they are. Immigrant folks, women, young people, bodies of any size, people with disabilities, people of color. We all deserve health care that affirms who we are, and trans and genderqueer people are no exception. My name's Derrick Travers, and I live in Portland. I've lived here for most of my life, about 30 years. In my mid-20s, I started to get the idea that I was going to need to transition from female, and at the time, there wasn't a lot of information, so in looking around, I knew I had options, and some people decide to pursue medical options, some people don't. I found a lot of employment discrimination. I found it was very difficult to get a job or even an interview. My education and my work history was under my female name and as a woman, and then at some point had to start building a work history as male. So it was this very vulnerable point anyway, and it's also psychologically difficult. And in this moment, I realized that I'm looking at, $10,000 in medical expenses that are gonna come out of pocket. There's a part of me that was like, this is hard enough. Like, this is it's one of the biggest challenges I have undertaken, and it's daunting, it's challenging. It's one of those things that it almost seems insurmountable, and there were definitely times when I questioned, am I gonna make it? Is this gonna work? I remember it was very difficult to find steady employment or full-time employment, and when I did get my first kind of like full-time job, office job, it happened to be, I had medical insurance, which was great, and they mailed the policy, and it's an inch thick, and no one ever reads those things. And I remember looking through every page trying to see if they covered trans or gender-related medical expenses. And I remember there was one paragraph that explicitly said, we won't cover anything for transgender patients. And reading that felt like being punched in the stomach. It was one of those things of, it felt like being singled out. It felt like them saying, we would provide this for anyone else, but not for you. And that was, it just felt like one more thing on top of a very, difficult path that we need to walk. So I started working for the health department, and they had mailed the policy, and I looked through it, and it specifically excluded trans people at the time that I started about 10 years ago. And, during that time I had talked to the union, and they were kind of like, we can't really help you. And I had done a little bit of pushback of saying, hey, listen, this is medically necessary. Why won't you cover it for me or other employees? And it kind of didn't go anywhere. And then at a certain point, a group of allies, trans people and genderqueer people, kind of got together and said, hey, let's do this. And so after a couple years of, diligent work, we got it passed. Like, they said, yeah, you're right, we'll fix that, and we're not going to exclude healthcare for trans and genderqueer people. And to be able to be a part of that team felt like such an honor. It felt like the health department, my employer, really does support inclusion, diversity, respect for all employees, seeing diversity as a strength, not a liability. It changed things quite a bit. It makes the hair raise on my arms. It makes me feel elated to be able to make that kind of difference for my peers and the next generation.